Hey everyone, Dr. Charlie Johnson, PT here. Hey, just wanted to shoot this video. Could not wait to get back into some good lighting here, so hopefully you can bear with that. But that being said, I want to shoot a video after I just got through a day of working with people. My specialty is helping people with back, butt, hip, and leg pain due to whatever the diagnosis may be, get back to normal using motion. A lot of people call me Mr. Motion, as that's what I use for medicine. So that being said, basically what happened, and I think this is super important for everyone to know, is that on multiple occurrences today, I continue to find this trend where as soon as I chat with somebody and sort of let them in on what I think is their best solution, they have what most people have, which is some type of follow-up, say with a spine surgeon or another doctor, because right when you're in pain, you tend to go insane. It's not your fault, but that's just what pain does to you. And you start setting up appointments with various doctors or specialists, right? And you start doing all kinds of different things. The problem with this is that everybody's going to have their own opinion. Everyone's wearing their own goggles, right? So when you go to see the spine surgeon, what always happens is because they are at the top of the ladder, right? And they are seen sort of as the go-to person and the specialist who should be able to figure this out. And they have all the tools to figure it out, such as MRI machines, x-rays, things like that, is that people go to these doctors and the doctors say, hey, don't even try motion. We want to get an MRI first to figure out what that problem is before we do anything. And what I'm telling you is that if you're doing that, you are probably, and what I say is, I say this with the most respect, you're probably barking up the wrong tree. And what's going to end up happening, I had a patient who said to me, Charlie, he said, you see ghosts. And what he meant by that is, what you see is just, you're going to go to somebody, you're going to get a diagnosis, you're going to figure out what it is, and then through that, you're going to be able to solve the problem, right? As if you walk through that door and you get that image and you figure out what's going on and you get a label, that is going to lead you closer to the solution. And the problem is it won't. In fact, it leads you further away from the solution. So consider that when you get a diagnosis, it boxes you in. It actually puts, it puts you in a room, it puts you in a box such that if you have a disc problem, right, which by the way, almost everybody has one. In this case, the gentleman that I just chatted with was 70 years old, and he wanted to figure out what was going on before we ever use something as simple as motion to solve the problem, because he was convinced, that he could solve the problem through finding out what it is, right? And then that would lead to some type of different or unique intervention other than what I was telling him. And look, the truth of the matter is that when you get a diagnosis, again, it limits your ability to heal. It constricts it. Picture like you're stepping on a hose or something like that, right? Because instead of having just, openness, right, to the possibilities of what you could do to solve the problem, you start to get boxed in by that diagnosis. So I had a woman reach out to me recently and said, Dr. Charlie, I'm just so confused. I have this disc problem and, it doesn't like bending backwards. It hurts. And everyone on the internet is telling me to do these cobras, but it's just not working. I'm just so confused. And no, she is maybe not confused, in and of herself. She's confused because the diagnosis does not match how she should respond or what she should be doing, right? So whenever you get a diagnosis, it's very easy to say, hey, you go to this room, cell number 1, door number 1, and behind that, if you've got a disc problem, you've got press-ups and you've got nerve glides, and avoid rounding your back because that could hurt you, right? That type of thing. And this is the exact thing that keeps you from healing, because all those things that you think you shouldn't be doing, you probably should be doing. So that being said, just consider the diagnosis limits your ability to heal. All right. So now another thing is that you've only got 4 options for treatment. So number 1 is pills. Number 2 is shots. Number 3 is surgery. And number 4 is motion. Now, what do you want? It comes down to this at the end of the day. So for example, I'll include the summary to the article below, but this stuff needs to be, the cat needs to be let out of the bag. And what I mean by that is there's all these publications in these journals, the Journal of Spine in 2017, for example, and this is just fascinating and something I think about that I wish people knew, but they don't. So this is my way of getting it out. Hopefully it reaches a lot of people. But there was a 63-year-old woman with leg pain, basically, and she goes into get an MRI, and within a few week period, she gets 10 MRIs at 10 different centers, and nobody really knows about it, all right? And what they find is that she gets 10 different results. So basically, nobody can agree on anything. So the diagnostic utility of the images is found to be basically crap, okay? So what that means is that you think, hey, I'll get an MRI and this will solve my problem. Well, no, everybody your age probably has some type of issue, and they may or may not feel it. So how do you know when you get the results of an image that that thing that they found isn't something that just showed up? Because, by the way, you have pain, so let's go search. And if you search for something, you shall find it. I think that's an old saying, right? So just get that the utility of these things is just really questionable at best. When they are useful, right, is if we're concerned about some type of cancer, fracture, infection, and or you've got some type of serious nerve damage, complete numbness in the leg, you're wetting yourself, can't control the bowel or bladder function, and or you're dragging your foot drop, right? That type of thing. Yeah, be concerned. But other than that, don't punch through the window to unlock the door if you've got the key in your hand, and that key is motion. Think of what you've got as like a padlock. There are certain types of motions or things that reproduce your problem. You've got to use motion to unlock that. You've got to use motion to evaluate it, to find which motions feel good, which motions don't feel good. And somebody's got to teach you that. Sure, you can go to someone and they can move you. That's one type of motion. But another type of motion is one where somebody like myself teaches you how to use movement as medicine, how to self-assess. Because, it's one thing when your car breaks down, you just go get another, you get a rental while it's being fixed, right? But it's another thing when you are the car, when you are the vehicle. You can't just step outside of it while your pain and your structure gets sorted out, right? You're in it. So when you go home, you leave the mechanic, and therefore you leave any potential for you to solve this problem, behind, because you become reliant on that person to fix you, right? So just realize that, you've got the key in your hand. You've got to find things that, if it's reproducible with motion, if you can move a certain way, and I can even show you how to do that, right? Maybe I'll put another video up here. I can show you a simple examination that you can do to go through various motions in the spine, forward, backward, to the left, to the right, twist this way, twist that way, and you can use that to kind of analyze yourself to determine, hey, is this thing reproducible with motion? I don't see any trend. It seems like, I don't know what's causing it. Well, there usually is a cause. Most of these problems, 99% of, say, back problems are caused by something in the muscles or the joints or the tissue or the nerves, right? And 0.5 to 1% is due to something where you might need an MRI, but instead 99 out of 100 people are going to get an MRI first, and padding the pockets of physicians and surgery centers. There, I said it. The number one predictor of whether or not you will have spine surgery is zip code. It's not how bad your MRI looks. So the only utility is that the surgeon would get reimbursed for something like a surgery or like an injection or like an image, right? When they know darn well that it's not going to change the outcome of the treatment, because they're going to say, okay, well, here's what we've got. We've got a disc problem, and oh, Charlie or somebody else could have already told you that. But because, we want some chang, some moolah, and this is just the way we do things because you came to us. And by the way, the patient then says, oh, this person, they should be able to help me. So they go through with it, and they believe that that person's going to give them something different. And then on the other end is just, well, here's a picture, a very expensive picture, and here's what it shows. We can't be so sure this is actually what's causing your pain, yada, yada, yada. Which do you choose? Pill, shot, surgery, or motion? By the way, if you've gone to the specialist, the surgeon, orthopedic, neurologist, things like that, just realize, and it's not your fault, this is just what we're trained to do, right? Your knee hurts, you go to the doctor, right? Who is the doctor traditionally? The family doctor, the specialist in this case. These people, what do they have on their menu? They have pills, shots, or surgery. So if you don't want those things, you already haven't used the simplest solution, one that you could potentially, unlock on your own via moving certain different ways, because you've already found that this is a motion-based problem. Then you need to treat it with motion. Then please steer clear of going to see a specialist like this, because yes, they're a specialist, but they're a specialist in pills, shots, or surgery. They're not a specialist in motion. So when you go to a family physician, when you go to an orthopedic physician, I'm not saying there's anything bad with them. If you have trauma, you're in a car accident, you break your back, absolutely, okay, you want to go to someone like that. But if it's a simple ache or pain that, hurts whenever you pick something up and now your back's gone out on you, or you have some pain in the buttock or whatever, they sure as heck are not going to be able to figure it out. And the truth is, if I'm being honest with you, most of the times I can't figure it out. Now, I don't know the exact tissue source of most pain, but what I do know is that there's a movement pain relationship. And if you keep focusing on the diagnosis, on finding the answer, you're going to keep hunting for forever. Now, again, that's not your fault, but the sort of healthcare has led people down that rabbit hole, and it often ends in just a lot of wasted time, energy, and money, and disappointment, and then thought viruses, things that you've learned that I have to try to undo. You should do this, you shouldn't do this is wrong, this is wrong. None of that crap might be wrong with you, okay? Instead, if we can find motion or a series of motions, right, calm the nervous system, teach you about, the actual things in your life that are nicking the scab and keeping things from healing, and then combine that with motions that are yummy, motions that feel good, right, we give you the best chance of healing. And, last thing here before I roll, is a lot of people think that surgery is the last resort. Like, okay, I'll do motion, I'll do PT, I'll do chiropractor, I'll do massage, and then I'll get take this pill, and then I'll take this injection, and surgery. It's my last resort. The problem is yes, in some cases it may be if things are really, really severe. But again, only if you've got some type of significant nerve compromise. Really, surgery. That's what's indicated. That's what surgery is indicated for. Other than that, for pain, surgery is no better than these other things. Specifically, someone who's really good at looking at motion, all right, and somebody who's really good at educating you and empowering you to solve it using motion and using natural based treatment. So just know that people think that if this doesn't work, so therefore oftentimes they don't put a lot of energy into it, or they bypass it because they don't think it'll work, because they believe this will work. And by the way, it's important, you got to believe that you can heal naturally if you're going to, otherwise it probably won't work. But you jump right to here, you jump right to surgery, or jump to the surgeon, and those things are no better. They have no better outcomes. It's not even resort. There's nothing resortful about a surgery, all right? There are a lot of surgeries that don't go well. I'm sure there are some surgeries that do go well. So absolutely, if you're watching this, you've had a surgery and it's been valuable, then awesome. But we just know by and large, for you, that's great. But by and large, the surgical outcomes are not better than what we do using motion. And again, at the end of the day, even if you do have a surgery, if you have a shot, and again, it works great, but it doesn't teach you anything about the problem. It doesn't teach you how to solve your own issue. It doesn't teach you how to realize what started it in the first place, and maybe how you could go about managing this in the future such that it doesn't reoccur, right? So a lot of people have back surgeries. They will need a second, right, within, I believe, within 4 years. So 40% of those folks, 4 out of 10 of those folks will need another back surgery within that 4-year timeline, okay? I could be slightly wrong with that quote, but the point is, it doesn't freaking matter. A lot of people, if surgery was the ultimate fix, they wouldn't be getting second surgeries because the level above or the level below is now, at risk, or whatever, okay? So the point is I think I've got that out of my brain, off of my chest, and I can sleep a little bit better tonight. Hopefully this message resonates with somebody, but just know that you need to understand that going in, okay? You need to know what restaurant you're going into, what they serve, and do you want it, do you not want it? And ask yourself, hey, what will the outcome of this be? If they find this, do I even need this image, right, to determine what's going on? And is it that important? By the time that you have gone, or by the time that somebody goes to figure out what the problem is, by getting an MRI, going to see the specialist, right, we could have solved it. You could have been going through motions. You could have been trying to get to the bottom of things. You could have been educating yourself. But instead, right, again, most people are used to relying on someone else or believing that the intervention is going to be, or the image is going to be the solution. And by the way, look, the image is read and sort of reported upon by radiologists. These radiologists are, often independent of the surgeon. So the surgeon is not the one writing up the report. The surgeon is talking to you. They're putting you in a bubble, by the way, usually when you don't have pain, because you feel good when you're laying down or something like that. So you're pain-free in the bubble, and they take an image, and then they use that to explain why you hurt when you move. Doesn't make sense. Anyway, you go to a radiologist who knows nothing more than you're 45 years old and you have back pain, and then they write up this report. And if you go to 10 different MRI centers, you will get 10 different results. So how the hell, if that happens, is that going to help you get any closer to what's going on? If nobody, these professionals and specialists, specialist can agree on what's going on. Again, they are specialists for a reason, but they should only be utilized in specialized situations. Back pain, buttock pain, leg pain, it's not to belittle what you're feeling, but they are not specialized situations that require further imaging. They require further active treatment and involvement on your behalf, and these folks should be proponents of that. But instead, they're taking money, they're taking time, they're taking energy, delivering broken and sort of dead-end promises that, hey, they'll figure out what's going on. And don't do motion. When the heck and why the heck would somebody, a surgeon, tell somebody not to do motion? Well, are you gonna like sit in your room all day and not do anything? Because last I was aware of, that life is motion. So don't live life because it could make you worse. Well, look, you're already worse, and that's why you're watching this video. So the point is that, take it upon yourself to start using motion, or find somebody who can understand motion, unlock that healing potential. That's the goal. Remember, you're just one motion away. You just have to find it, and you need somebody to coach you through that. So if you have any questions, again, sorry for the rant there, but I think it's something that just needs to be out there. Hopefully you grab some nuggets from that. Be aware of where you go, what you do, and sort of, are you focusing on problems, or are you taking what is going on, right, and starting to focus on solutions? And in this case, you own the solution. You're just not aware of it. You've been led to believe that somebody else needs to do something to you, or find something that is external to you by using some type of, device, image, whatever. So again, this is Dr. Charlie. If you need help, if you have questions, just you can apply to chat with me. Go ahead, visit below www.calldrcharlie.com, calldrc.com. Would love the potential to chat with you and see if we can help you out. Thanks so much, everyone. Until next time, take care.